Let's take a closer look at how bone growth is regulated. It's important to regulate bone growth and remodeling for a couple of reasons. One is to ensure the proper size of the bones, and another is to regulate the calcium level in the body. Those are the main reasons that we are going to be controlling what's going on with growth and remodeling. The endocrine system plays a very important role in this. There are a number of hormones involved in regulating bone growth and bone remodeling. Let's start by looking at the bone growth and some of the hormones that are involved in regulating the size of the bones. One of the most important is growth hormone. Growth hormone is a hormone that's released from the pituitary gland of the brain, and it affects almost all areas of the body by stimulating cell division to increase growth. This includes stimulating the division of chondrocytes within bone to stimulate bone growth. As with many things in biology, we need to have just the right amount of growth hormone. Too much or too little can cause problems. The production of too much growth hormone causes the bones to grow too much. They get too big. If there's too much growth hormone during childhood, this leads to the condition of gigantism, where the child grows extremely large due to the stimulation of growth hormone. In some cases, we can see situations where growth hormone may have been at relatively normal levels during childhood, but then increases in adulthood. Too much growth hormone during adulthood causes the condition acromegaly, where someone will continue to grow throughout their life and get larger and larger due to the activity of the growth hormone. Now, the bones won't really get longer, but we can see growth of all sorts of other tissues. This sort of growth really puts a lot of stress on the heart. So individuals with acromegaly often suffer from heart problems because it's a lot of effort to try and support that very large amount of tissue growth. Andre the Giant was a famous person who suffered from acromegaly. Too little growth hormone has the effect of causing someone to be very small. The bones and other tissues don't grow very much. A lack of growth hormone causes what can be referred to as proportional dwarfism, where you have someone with very small stature, but all of the body features are in relative proportion to each other. In this picture, we can see a famous dwarf, General Tom Thumb, on the occasion of his marriage to his wife Lydia. And here in the background is a normal-sized individual who officiated. You can see how these individuals with proportional dwarfism, due to low levels of growth hormone, have normally proportioned bodies. They're just very small. Another hormone that plays an important role in bone growth is fibroblast growth factor. Fibroblast growth factors stimulates the division of chondrocytes in the long bones. So this is going to cause the division of chondrocytes in the epiphyseal plates to cause growth in length. Individuals with a defective receptor for fibroblast growth factor don't get that hormone signal, and their long bones don't grow appropriately long. These individuals have short long bones, but relatively normal-sized flat bones and irregular bones. So their torso and head are approximately normal-sized, while their arms and legs, hands, and fingers are much shorter in proportion to the rest of their body. This form of dwarfism is called achondroplasia, and again, it's due to a problem with responding to the signal fibroblast growth factor, affecting only the long bones and not so much the rest of the bones. The hormones testosterone and estrogen are also important for promoting bone growth. These hormones stimulate bone growth, and they also are responsible for promoting the closing of the epiphyseal plate. These hormones make sure that we close the plate by turning all of the cartilage in the epiphyseal plate into bone, into the epiphyseal line. Individuals with an estrogen deficiency, not enough estrogen, actually grow to be taller than normal. And this is because those epiphyseal plates don't close. We get more and more growth without closing the plate to stop the growth in height. You can actually stunt someone's growth by giving them estrogen. If you give someone large doses of estrogen, it stimulates those epiphyseal plates to close and stops the growth in length. Let's turn our attention away from regulating bone growth and look at how we regulate calcium balance, the level of calcium in the blood. Most of the time we think of calcium as being important for bone health, which it is, but it's much more important that we have the calcium that we need for our muscles and for our nerves to work. Without calcium, muscle function and nerve function are impaired, and that's a lot more important than having weakened bones. A normal blood calcium level is between 9.2 and 10.4 milligrams per deciliter of blood. That's a pretty narrow range. If we have calcium levels that are either too high or too low, things don't work properly. Having too little calcium in the blood can lead the nerves and muscles to be overly excitable, so they respond too easily and can cause spasms. Whereas too much calcium in the blood can cause the bones and muscles not to respond as well, making them less responsive and leading to weakness and slow response times. In order to maintain the proper level of calcium in our blood, we have to balance the amount of calcium coming into the blood with the amount of calcium going out of the blood. There are two sources for calcium coming into the blood. Calcium comes into the blood from what we eat. The calcium-containing foods that we eat go through our digestive system, and the digestive system absorbs the calcium into our blood, which is going to help raise calcium level. We also can get calcium into our blood by breaking down bone. The more bone matrix we break down, the more calcium gets released into the blood. We can remove calcium from the blood in two ways. We can use that calcium to build bone, or we can get rid of the extra calcium through the urinary system. When the blood goes through the kidneys, extra calcium is removed from the blood and put into the urine, and we can urinate that away. In order to make sure that we regulate the proper balance of the calcium in and the calcium out, we have hormones that help with that. When blood calcium level gets too high, whether it's from consuming too much calcium or too much release of calcium from the bones, the extra calcium is filtered out in the kidneys and removed from the urine to bring the calcium level back down where it belongs. In some situations, especially in children or with pregnant women, there's a hormone that assists with this. When blood calcium level gets too high, the hormone calcitonin is released. Calcitonin is released from the thyroid gland, and the calcitonin goes out into the bloodstream, and it stimulates osteoblasts to build more bone. So as long as there's excess calcium available in the blood in children or in pregnant women, calcitonin stimulates more bone building. That takes the calcium out of the blood and reduces the amount of calcium in the blood back to the normal levels. Because it's relatively easy to excrete extra calcium through the urine, high calcium levels isn't usually a problem. What's more problematic is when the calcium levels get too low, either due to not enough calcium coming in the diet or excreting too much calcium in the urine. When the calcium level gets too low, this stimulates two important things. We have the release of parathyroid hormone and the activation of calcitriol. Parathyroid hormone is released by 4 small glands that are attached to the back of the thyroid hormone. These small glands release parathyroid hormone into the blood. Parathyroid hormone helps to increase our blood calcium level in several ways. First, it inhibits the activity of osteoblasts, so it stops us from making new bone. Second, it stimulates the activity of osteoclasts, causing the osteoclasts to start breaking down the bone matrix to release calcium into the blood. And third, parathyroid hormone increases the production of calcitriol in the kidneys. Let's take a closer look at calcitriol. Calcitriol is better known as active vitamin D. We've talked already about some of the steps involved in vitamin D processing. We start with cholesterol in the skin, and UV light from the sun penetrates the skin and converts our cholesterol into an inactive form of vitamin D. This inactive form of vitamin D then has to go to the liver where it's converted to calcidiol. Calcidiol has to go to the kidneys where it's converted into calcitriol. Calcitriol is the active form of vitamin D. Low calcium levels in the blood stimulate the release of parathyroid hormone, and increase the production of calcitriol. It increases the activation of vitamin D. Calcitriol, or activated vitamin D, helps to raise the calcium level in several ways. First, it allows the absorption of calcium from the intestine. Without the calcitriol, the active vitamin D, it doesn't matter how much calcium you have in your diet, you won't absorb it from the intestines. But with vitamin D present and active, we absorb calcium from the intestines, so that helps to raise the calcium level in the blood. Calcitriol also affects the kidneys and tells them to reabsorb more calcium. So instead of letting the calcium go out in the urine, we take the calcium back from the urine, and that helps to keep the calcium levels in the blood higher. The third action of vitamin D is to increase the activity of osteoclasts. We produce more osteoclasts to break down more bone and help to raise the blood calcium level. As we saw before, having a low level of vitamin D in the diet or low levels of calcium in the blood leads to having weakened bones. If this is occurring during development, we have softer bones that can't withstand the weight of the body and they deform, and that's the main symptom that we see in rickets caused by a vitamin D deficiency. A vitamin D deficiency or lack of calcium in the blood in an adult can lead to osteoporosis. The continual activation of the osteoclasts breaks down the bone so that the bones become much thinner and weaker and much more prone to degrading or breaking. Osteoporosis is linked to a number of risk factors, including poor diet. If you don't have enough vitamin D or calcium in your diet, you can end up with osteoporosis. Lack of weight-bearing activity. If you don't have weight-bearing activity, you're not stressing the bone to stimulate the osteoblasts, and so the osteoclasts can continually erode the bone without building back up. We also see this linked to low estrogen levels. Postmenopausal women are at the highest risk for osteoporosis because without the estrogen to stimulate bone growth, they can end up with osteoporosis due to the activity of the osteoclasts. This is why a healthy diet and weight-bearing exercise is particularly important in postmenopausal women to make sure they maintain bone health. And finally, osteoporosis is linked to increasing age. The older you get, the less well everything works, and the more likely you are to end up with poor absorption of nutrients, or poor activation of hormones, or poor vitamin D synthesis, and end up with osteoporosis.